Welcome to this week's Health Policy Institute recorded webinar, updating the latest data on the impact of COVID-19 on the dental care sector. These are data from the week of November 16th. I'm Marko Vujicic. My colleague Chelsea Fosse will be joining us shortly, and we'll be taking you through what the latest data show us. Before that, just want to make sure all our listeners know, out of our consulting side in HPI, we recently released a very comprehensive report on how COVID-19 is reshaping dentists' habits for purchasing equipment and supplies. So if you're interested in knowing the type of equipment and supplies dentists are interested in purchasing in the next few months, how they want to interact with sales forces, you can get all that information there. The report's very reasonably priced at $400, and it's full of very rich data tables, but more importantly, our key insights on what manufacturers and distributors need to know about how dentists are changing their habits. And that's at ada.org/HPI. As usual, Chelsea's going to update us on the latest trend data. Again, these are data out of the week of November 16th. We have questions of the week as usual, very interesting analysis, focusing on where we are in terms of maximum patient capacity relative to current patient capacity, as well as how dentists tend to respond going forward to maintain financial solvency. And as usual, we'll also have the latest consumer data to share as well. Full methods are available at our COVID link at ada.org/HPI. I won't go through this, but this is data sourced from thousands of dental practices across the US. With that, I'm going to turn it over to Chelsea to walk us through the data and the key insights. Over to you, Chelsea.
Thank you, Marko. We're going to begin here as usual with an update on practice operating status. When asked, what is the current status of your dental practice? 98% of dental practices in the US were open as of the week of November 16th. The green line shown here indicates those that report open and business as usual in terms of patient volume. 33% of practices were open and business as usual as of the week of November 16th, representing a steady decline over the past couple months. There are some variations by practice size, DSO affiliation, and geography, all available in our full report online at ada.org/HPI. Taking a closer look at patient volumes, we asked, how does this week compare to what is typical in your practice in terms of total patient volume? We found that on average, nationally, patient volume in dental practices was at 76% of pre-COVID-19 levels as of the week of November 16th. Again, a slight decline over the past couple months. Here we're comparing patient volumes by the geography of the practice location. So the same question is represented here. How does this week compare to what is typical in your practice in terms of total patient volume? Going from the top bar, we have the top 20 largest cities, then other urban areas, suburban areas, and rural areas. On the far right of this slide, you'll see the overall averages for each of the practice categories by geography. Patient volume was highest, 78%, in practices located in rural areas, followed by suburban, then other urban areas, and finally practices in the top 20 largest cities in the US were at 72% patient volume versus pre-COVID-19 on average. This is an update of our COVID-19 cases and patient volume. Each dot here represents a state. We've excluded states where we had fewer than 30 responses. So this is isolated to the states where we have sufficient sample sizes. On the x-axis, we have the number of new COVID cases per 100,000 people in the state from mid-October to mid-November. So on the right side of this slide, you see those states that had the greatest increase in COVID-19 cases. And on the left part of the slide, you see states that had the least increase in COVID cases. On the y-axis is the change in dental patient volume in that same time frame, mid-October to mid-November. So up top, you see states that had an increase or an increase in dental patient volume. And down below, you see the states that had a decrease in patient volume. The dotted trend line shows that there is a very weak relationship between COVID-19 cases and patient volume at the state level over that time period. To some extent, we can see that states with a greater increase in COVID-19 cases in their populations have experienced a greater decline in patient volume over the past month. We've also been tracking staffing in dental offices. Dentists are asked, is your practice paying staff this week? Response options include yes, fully paying all staff, yes, partially paying part of my staff, and no. The green line here indicates those who are paying their staff fully as of the week of November 16th, 90%. This has declined slightly since mid-September. In the report online, you can also see that roughly one quarter of associate or employee dentists are not being paid fully as of the week of November 16th. PPE supply has been tracked in terms of days of inventory. The supply categories of interest include N95s and KN95s, surgical masks, face shields, gowns, disinfecting supplies, and gloves. Looking at each bar and going from red on the left, indicating 0 days supply, all the way to green on the right, indicating more than 2 weeks supply. These figures haven't changed much in recent waves of polling. PPE supply on the whole was stable for the week of November 16th. Gowns and N95s remain a challenge for some. Now we'll get into our questions of the week for the week of November 16th. We wanted to get a sense of patient capacity in dental practices, comparing the number of patients actually seen in practices last week or the week prior to November 16th, compared to the current maximum number of patients the practice could see. When comparing these figures and taking the ratio, we see that the majority of practices are operating below 75% of their current maximum capacity, and the greatest share are seeing 50 to 75% of the patients they could accommodate. Less than 1 in 10 are operating at greater than 95% of their current maximum capacity. Available online are also the breakdowns by practice size, DSO affiliation, and geography. And there we've seen that large group practices are closer to their current maximum capacity. Here we'll cover a couple questions related to financial sustainability measures that dentists are taking. These questions will look familiar as they were asked a couple months ago in September. We wanted to get an end-of-year update from dentists across the country. We asked, since you reopened, have you taken any of the following measures to maintain the financial sustainability of your dental practice? On the left in the small font, we have downsize dental team, reduce dental team hours, reduce wages or benefits, disenroll from benefits plans, change your supplier or lab, raise fees, borrow money from bank, sell your practice, join a DSO or large group, or retire. Green indicates the share who said, yes, I've done this. Similar to September, we see that the most common measures already taken by dentists included borrowing from a bank, raising fees, and reducing staffing. Here we're comparing that same question. Since you reopened, have you taken any of the following measures to maintain the financial sustainability of your practice by DSO affiliation? So up top, you see the practices that are affiliated with a DSO, and on the bottom, you see those that are not affiliated with a DSO. DSO affiliated practices have been more likely to downsize the dental team, while practices not affiliated with a DSO have been more likely to raise fees or borrow from a bank. This is a new question looking a bit to the future. Assuming that your patient volume remains what it is today through the end of the year, would you consider any of the following additional measures? The same list of measures are listed on the left as you saw before. Raise fees is the most common measure being considered, with the majority indicating that they would do this if patient volumes remain. Next in line is reducing dental team hours. About 1 in 5 will consider selling their practice, and 1 in 6 would consider retiring. Here we have responses by age group, and shown on this slide are those in the age category of 65 and older. There's been very little change in this population of dentists from September to October. More than 1/3 of dentists 65 and older indicated that they would consider selling their practice, and roughly 40% indicated that they would consider retiring if patient volumes remain stable or what they were the week of November 16th. In our master file data in the ADA, we have not picked this information up yet. This is all self-reported information. Now we'll flip gears and look at some data regarding consumer sentiment towards visiting the dental office. We've been partnering with a consumer research firm, Vujicic, to explore consumer sentiment. This pie might look familiar to many of you. Among consumers who are dental utilizers or folks who had a dental visit in 2019, we've been asking which of the following conditions is closest to your current point of view regarding visiting a dentist's office. On the right side of this pie, you see that 60% of consumers are ready to go. They're ready to head back to the dentist. 23% have been recently active. They've already been. 5% are assurance seekers. They need a little extra comfort before heading back. And about 12% need a medical breakthrough. Those are folks who will need a vaccine or proven therapy before heading back to the dentist. Those slivers in yellow and red, the assurance seekers and medical breakthrough, have been decreasing the past few waves. And you'll see this on this next slide as well. Here with Vujicic, we've been looking at consumer sentiment towards a number of everyday activities since April. There's a lot going on here, but if you look at that forest green line indicated on the left, or sorry, on the right on the legend, you can see 3 items down is visit a dentist's office. And we see that that's near the top and it's increasing. We've had a lot of positive news regarding vaccine development as late, which is key for bringing those assurance seekers and the medical breakthrough folks back to the dental office. Let's recap the key takeaways presented for the week of November 16th. In terms of recovery and renewal, 1/3 of dental practices reported being open and business as usual in terms of patient volume. Patient volume was estimated at 76% of pre-COVID-19 levels, representing a slight decline over the past couple months. Staffing in dental offices was at 90% of pre-COVID-19 levels, also down from previous weeks of polling. In terms of patient capacity, nearly all practices have the capacity to see more patients than they are currently seeing. More than 1/3 report being at 51 to 75% of their current maximum patient capacity as of the week of November 16th, with fewer than 1 in 10 operating at greater than 95% of their current maximum patient capacity. Large group practices are closer to their current maximum capacity. In terms of measures taken for financial sustainability, dentists are taking similar measures to what we found in September. DSO affiliated practices have been more likely to downsize the dental team, while practices not affiliated with the DSO have been more likely to raise fees or borrow from a bank. For future considerations for financial sustainability, if patient volume remains what it was the week of November 16th through the end of the year, dentists are likely to raise fees. Among dentists 65 and older, more than a third indicated they would consider selling their practice, and roughly 40% would consider retiring. For consumer sentiment, it's clear that the development of a vaccine remains an important part of bringing the remaining patient base back into the dental office. Thanks for joining us for these updates from data for the week of November 16th. On behalf of Marko and the entire HPI team, a sincere thank you to all of our panelists for the time they dedicate on a bi-weekly basis, allowing us to take this pulse on the dental care sector. Thanks again, and take care.